Okay. And I want to thank everybody for participating here within our updates for 2016. I want to introduce the two panelists besides myself. We have Chad Schiffman. He is our Director of Research and Development. And we also have Michelle Lyman. She is our Operations Manager. And they will be handling different portions of the content. Okay? So with that being said, did you want to introduce yourselves? At least say hello, Chad and Michelle.
Hello. I'm Chad.
Hi, this is Michelle. I'm glad to be here today, and I'm looking forward to a great webinar with you.
So we're going to be covering regulatory change for our 4 key compliance areas: HIPAA, OSHA, corporate compliance, which includes the CMS mandates, and HR as far as labor laws and any regulatory change for those in 2016. And so that being said, let's start off with HIPAA and talk about what's going on with desk audits. And for that, we'll start off with Chad. Okay?
All right. Well, first and foremost, I'd like to apologize real quickly for my scratchy voice. Under the weather a little bit, but I'll make do the best I can. As we run through this, we'll start, like Eric said, with HIPAA. And I'd like to, after, we've been reviewing and watching all the information coming out, and probably the biggest thing that we're seeing this year in HIPAA is that HIPAA will be the year of the HIPAA. Well, in 2016, HIPAA especially will be heavily involved with HIPAA desk audits from the OCR. It's largely being referred to as the year of the HIPAA audit, and this is because, as I mentioned, OCR will be performing comprehensive audits of covered entities and business associates. And the reason why is they're looking to check your compliance with HIPAA privacy, HIPAA security, are you reporting breaches timely? This was all addressed as part of the 2006 year plan from the OIG.
So what kind of different audits are there? And what are the audit priorities to be determined this year, Chad?
Well, this year in 2016, OCR is performing their audits, and what's different this year is they're not only focusing on covered entities, they're also going to focus on business associates to ensure compliance with HIPAA privacy and HIPAA security rules. That's one of the major differences we're seeing with that. These phase 2 audits were determined based on the results of their initial phase 1 audits that they performed a few years back. And and this year there's, as I mentioned previously, there's additional oversight, especially with the breach notification reporting rule this year. So far, they're planning on auditing approximately 100 covered entities for compliance with the breach notification standards. It's being looked at mostly because last year there were a lot of breaches in 2015. So this year they're expecting those numbers to climb for breaches, so they want to ensure that everybody's, reporting them the way they need to be, mitigating them. So it's going to be interesting, and those are numbers we actually expect to rise. So we're keeping a close eye on OIG, OCR, all their reaction with this breach notification rule.
Okay. Well, there have been new instances of HIPAA changes just in 2016. In fact, this National Instant Criminal Background Check System, I think there's some questions on how it applies to different organizations.
Yeah, and what we've seen is we want to make sure that covered entities understand that it doesn't apply to all covered entities. That's one of the questions we've had is, well, we saw that we're allowed to disclose for purposes of background checks now for anybody with a mental health prohibitor. And that's just simply not true. There are certain groups of covered entities who are allowed to disclose, and those covered entities are those lawfully authorized to do so under, if they make the adjudications or commitment decisions that affect individuals, then they can do it. Or if they serve as repositories of information for NICS reporting purposes, those individuals do it. But it just doesn't mean that every entity is permitted to do these disclosures. That's something that we really wanted him to be aware of. And, it could possibly be with that, there's another rule that's on the horizon that was recently announced with patients wanting to be able to seek more care with these new models that are coming out. And this included patients who are substance abuse patients. So HHS has thrown out a proposed rule, and we're waiting to see how that trickles down as well.
Okay. And that's that confidentiality of alcohol and drug abuse. Is that what we're talking about as well?
Yeah, that's exactly what we're talking about. I snuck that in there because I think that the two are almost going to tie together in the future. I mean, I'm not sure, but it's looking that way from what we've been reviewing. And they're just trying to make it so that patients can get more care and feel, confident that their privacy is being respected. So it'll be really interesting to see how that goes. I know there's been a lot of patients rather concerned about both, with their mental health issues and also the background checks for those type of things. So it doesn't surprise me to see these clarifying rules coming out this first part of the year.
If we talk about the breach notification process, Chad, it seems like people are concerned about reporting breaches because they're thinking that it's going to instantly create an audit scenario for their groups. And that, if you're looking at the breach notification audits, they're looking at people if they have been reporting the breaches as they should. Maybe some groups are wary of reporting a breach because they're looking at that triggering an audit. What has been your experience with that, Chad?
Well, what's been our experience is if you take care of all of these steps, meaning you do your due diligence in reporting the breach after you've mitigated, first you research, was there indeed a breach? You follow that process. Did this breach occur? Yes or no? And as you work your way through it, let's say you do determine there's a breach, it's very important that you notify the patient timely of an incident. And then if you are indeed required to report to HHS, do so. You're better off reporting to them and letting them know something happened. More often than not with these smaller breaches, what we're seeing is they're not, I don't want to say they're not as overly concerned, but as long as you're taking care of the steps to mitigate any future risk and take care of the patient who had the breach, we're not seeing that being an issue whatsoever. In fact, more often than not, they're putting the confidence in your compliance person to say, hey, we took care of these steps, we took care of this patient. So we want everybody to understand that if you do have questions with breaches, feel free to let us know. We have a breach service, and we'd be happy to help you with that process.
Okay. And then, one last clarifying thing on the HIPAA desk audits. I think the number one factor for everybody in a HIPAA audit in general has always been meaningful use participation, at least down at the covered entity and individual practice level. But are you saying that now the desk audits are going to be moving out of the institutional and educational settings and, again, into the smaller practice settings as well?
Oh, yeah. They've got approximately just over 300 covered entities that they're going to audit, and it's going to be largely based off of questionnaires that have been distributed. And depending on those responses will be determined if you are going to receive one of these initial audits or initial phase 2 audits, that is. And then based on those findings, they'll determine if they're going to actually add to that or if they're just going to stay status quo with those audits and then report their findings. But we anticipate more covered entities this year being audited than the initial projections.
Okay. And that's another thing. You have that small number up front, but that's their beginning number. Based on the findings of the initial sets of audits, they could expand the audit process significantly. Is that correct?
Correct. And, if you're one of those, that's why looking at a full compliance, making sure that your policies and procedures are in place, first and foremost, is critical. All covered entities that have their policies and procedures in place don't have anything to worry about. We just need to make sure that they are in place, they're enforceable, that your employees are trending on them, and that's what's going to be really defensible in one of these audits if you are selected for them. Another thing, they're not only doing the desk audits, they're going to be doing site visits at certain locations as well based, on how their results are coming in on these audits. And if they determine we're going to have to do some site visits, you might be one of the lucky ones that gets visited. But we want our clients to know that we're here to help regardless. So we've got your back in the event of an audit.
Well, I appreciate that clarification on changes, especially for HIPAA. I think everybody is afraid of getting that audit letter in the mail, most especially. So now we're going to focus over onto OSHA. For that, we'll be working with Michelle Lyman. Obviously, she's our operations manager at Healthcare Compliance Pros. And any significant changes to OSHA here for 2016?
Yes, there are. And if you'll go to the next slide, we'll go ahead and start visiting about OSHA. Just like HIPAA, there are a lot of changes in OSHA this year, so we're gearing up for some big changes and ready to help you with those changes as they occur during the year. The first thing that we'll discuss is the new Federal Civil Penalties Inflation Improvement Act of 2015. Now, that's a mouthful, but basically we can expect this to result in an 80% increase in fines for OSHA violations. So let me give you just a little bit of background on that. OSHA has been lobbying for years to increase the penalty amounts. Congress passed the Bipartisan Budget Act of 2015 in November of last year. It was signed into law by President Obama. And what this does is allows an increase in the penalties that OSHA can enforce. And what the difference is, it's based on the Consumer Price Index way back in 1990 is what we're currently being fined for. So now that they're updating that, there's going to be a one-time catch-up adjustment in the Act, and this will occur in 2016. And we are kind of watching the news on this. OSHA will adjust the civil monetary penalties. I know that there's an interim final rule that they're kind of looking at that must be going into effect by August of 2016. If we see anything earlier than that, we'll definitely be letting you know that there are issues coming faster than we had expected. But to give you an idea, the other than serious citation, that's one of their logo or their names for a citation, it's going to jump from what it was at $7,000 to around $12,000 would be the penalty. And then a willful or repeat citation could rise as high as $127,000, whereas right now the current penalty is at $70,000. So you can see that these are huge jumps. And again, we'll just keep an eye on these and let you know what the final ruling is. But basically, I guess I would encourage you to make sure that your OSHA program is strong so that you aren't going to be involved in any of these penalties. So,
yeah. So what we're
go ahead.
What we're seeing from OSHA right now is they're talking about an 80% increase in fines. And just to, again, a clarifying statement, these penalties haven't been raised in 25 years. So there's going to be a one-time catch-up adjustment where it could be as much as 80% all at once, but then they'll be tying it back to the CPI or the Consumer Price Index moving forward. Is that correct?
That's right. So that one-time catch-up adjustment will be a huge increase, and then it will increase with the Consumer Price Index from then on. So it could increase even higher in the future.
Okay.
So the next item that's kind of a big deal for OSHA is that we're looking at some new guidelines, and these are going to be looked at as sort of an implementation between 2015 and 2018, but there are 7 outlined areas, and these guidelines call for employers to take proactive steps. The proactive steps are just that. It's an encouragement. There have been no laws put into place for the workforce to actually be put under laws or regulations for this. It's just so that you as a provider or an organization are encouraged to protect your workforce further so that you are ensuring a safe workplace. And all of the 7 areas that OSHA is encouraging you to participate in will be included on the white paper that we're going to produce as a result of this webinar. It'll also be included in a 2016 compliance updates module. So we will make sure that everything that we're discussing here on OSHA is included in those 2 areas so that you can receive the additional details.
Okay. You know, what's interesting about the guidelines is they are just guidelines. They are specifically not rule changes, but they're suggestions. Is there any potential exposure for employers, maybe not from OSHA, but maybe from civil suits brought on by employees for not following guidelines even though they're not mandated specifically?
Yeah, we've been discussing that's a possibility, that if these mandates or encouraged protocols are not participated in, it is a possibility that an employee could down the road say, you know, I was injured on the job because my employer, my organization did not participate in enforcing these guidelines. So that could be a possibility that those investigations could occur because of complaints from your employees. So I guess what we'd like to say is just stay tuned. We'll keep updating you of any changes in the law or additional requirements to participate, but at this point we would really encourage you to look at those 7 areas and make sure that you are engaging in those. And through the HCP compliance program, most of those are already, or all of those are already covered. So if you're using our program, you're in good shape.
And I think the issue is the guidelines are very in-depth. They are available on the white paper. We're not going to go into specifics on those guidelines at this time.
Right. So the next thing that we'd like to speak about in OSHA is the major hazard communication standards changes. And I'm thinking that most people on the call are already aware of the changes that are happening, but I just wanted to take a couple of minutes and review what we're seeing. We know that the globally harmonized system is coming online in 2016, and that's going to change the labeling that is required and also change material safety data sheets to the safety data sheet format, which is a 16-section format, and also there are requirements for training. You'll notice on the slide that you're looking at that there is a deadline for employers to have everything in place by June 1st of 2016. So what OSHA is telling us is that by June 1st, users of potentially hazardous chemicals must have the updated labeling. So if you are repackaging products that come into your workplace, you'll need to make sure that the labeling meets the globally harmonized system requirements. You must have also provided your employees with any additional training. So if there are changes in your material safety data sheets as they change to safety data sheets, you need to make your employees aware of those changes on those forms. And I would really like to just encourage you to make sure that your binder is updated, make sure that you have all of the current safety data sheets.
Good. Well, you know, it's interesting. We'll maintain the safety data sheets once they're within the binder themselves, but making sure that all of those materials are within the healthcare compliance binder that's being maintained for you if you're participating in that program. Point.
So if you are participating in our OSHA Plus program on the HCP website, we're updating all of those safety data sheets for you. And we're actually going out to the manufacturers and researching, finding the most updated safety data sheets. So that's a great way to ensure that you're meeting that level of compliance. If that's something that you're not doing with us, then we would encourage you to obviously reach out to the manufacturers on your own and make sure that you've got those updated safety data sheets. But in addition to that, I would let you know that OSHA is quite aware that the manufacturers have not all updated their sheets at this time. And so during this phase-in period before June of this year, OSHA expects to see that there may be some sheets in your binder that are the old format, some that are the, the new final SDS standard. You may have one or the other or both. And so OSHA has stated that it's not unusual to see these elements of both standards, and that this will be acceptable. So if you are audited, or if you're concerned about that, just know that until that deadline comes in, you still have a little bit of leeway. And OSHA is continuing to update things. In fact, as recently as yesterday, we received an OSHA update where OSHA is seeking public comment on guidance for determining potential health hazards of chemicals on the labeling program. And they've already updated their entire labeling program, and now they're adding an additional level of inquiry. They're looking at weight of evidence determination, and so they're seeking comments at this time. So it continues to evolve, and I guess I'd like to just finish this OSHA discussion by saying we will continue to be aware of what's going on and pass that information on to you as our clients in future webinars, and obviously with our training and white papers.
Yeah. So obviously we're updating our materials. Some participants may be in charge of their own SDSs. I understand, the training requirements and possibly retraining. There was initially an OSHA training requirement on the GHS system, occurred clear back in 2013, but now some of the standards have changed, and some of the labeling may be driven by a location-specific requirement. And if that's the case, then retraining would have to occur, Michelle?
Yeah, so if anytime anything changes, additional training needs to be shared. So if there's chemicals that have newly identified physical or health hazards based on the GHS criteria, then those areas would need to be trained on. In fact, there are 3 different areas that need to be trained on. It's the hazard classification, the labels, and the safety data sheets. Now, all of this information is included in your OSHA training on HCP, but if you find that any of the chemicals that you're currently using are updated as far as labeling, or the SDS has additional warnings, then you would obviously want to retrain your staff to make sure that they were totally aware of any changes and that they were then updated on the most current information.
Well, thank you, Michelle. I appreciate those updates to OSHA for 2016. It does seem like there's a little bit of a, wait and see, wait for news. That obviously is something that HCP is directly involved in, is making sure that all of these updates are being applied to your program as well.
That's
With that
right.
being said, we're going to move from OSHA and we'll move over into EMS and corporate compliance. And for that, we'll be moving over to Chad Schiffman again, our Director of Research and Development. Chad?
Well, with CMS corporate compliance, there's a few big things going on this year. First and foremost, and depending on your stance on it, one of the biggest ones is obviously modified stage 2 meaningful use. That's probably one of the biggest things on everybody's mind, is meaningful use sticking around. And in 2016, what's supposed to happen is all eligible professionals are required to report on 10 objectives, and of those objectives, one of those will be a consolidated public health objective. What we really want everybody to understand with this is meaningful use stage 2 is going on this year. It is not going away this year just yet. And we ran through it. And, go ahead. Sorry, I'm sorry.
No, I was just going to say, they continue to modify it. Just in fact, in the last few days, they pushed back the reporting date from March 1st to March 11th. They continue to move the objectives around a little bit. How are the organizations keeping up with this, Chad?
Well, what we've done is we've gone through and we've analyzed all the objectives that have been made required for modified stage 2, and what we found is that there's several that are important that need to be handled by providers, obviously, but this year CMS is every bit as focused on a security risk analysis as they have been in the past. Providers must address the security, and to include encryption, you have to at least address encryption one way or the other, or you're going to need to prove your alternative method is at least as strong as encryption as part of your security risk analysis. And that's something that we're seeing a lot of confusion on. So that's one of the biggest things is, first and foremost, we've got to get everybody's security risk analysis done to make sure that they are safeguarding EPHI, to make sure those policies and procedures are in place. And then that's one of the biggest ways that we can help clients. And then also, as you've seen lately in the news, CMS has turned around and said, well, we're going to require providers to report and return overpayments as they've been identified, or as providers should have known about these overpayments. And that means that providers are going to be responsible to look back 6 years for overpayments and return any overpayment within 6 days of identifying them, or 60 days, of identifying them. So as we see, there's just a lot of different requirements for providers to keep up with, and we're hoping to be able to help our 2016 updates module, and we're here with questions all the time on this, and we just want to make sure that clients know that we're here to support them in meaningful use as well.
Well, I know, Chad, as the director of our R&D, all of the security risk analysis done for our clients falls under your purview. In defending meaningful use attestation audits, I know that the SRA is the most widely failed single data point on the meaningful use attestations, but even when they're successfully passed, there is work and effort that's involved in meeting that SRA requirement, isn't there?
Yes, because you have to have an action plan to address those deficiencies, and often what we're seeing is, people will complete a checklist, so to speak, and not have a plan in place. Then they'll come to us and say, can you help us out of this jam? We've ran into an audit request and we failed on our SRA. And that's one of the main reasons we're so vigilant in making sure that all of our clients understand the importance of doing an SRA and making sure that we're getting this action plan done, because with that, in the event of an audit, we can submit it and say, yes, it was done. We can show a timestamp on it. We can show the action plan. We can back it up with policies and procedures. And those are the types of things. Even this year, they're going to continue on with their audits. They're not doing away with them. With Modified Stage 2, there's not as much to report on by the looks of things, but the requirements are still there. You still need to make sure you're following them.
Yeah, I think it's funny that the SRA has now become the first measure rather than buried in the system, and I think that's probably because of the failure issues with that. With regards to corporate compliance in general, we see this Final Two Midnights rule. Has that changed corporate compliance and the training requirements in 2016?
Well, the Final Two Midnights rule, what we've done with that is we've gone ahead and we have put that into our white paper because we felt like we needed to cover that and ensure all clients understand that. We've also gone ahead and put that into our module as well. The Final Two Midnight rule is just basically to give more flexibility to the do they really need to stay for two nights? And I would say that's the biggest thing that they need to understand is it has changed. We have updated the training, but it's nothing as concerning to us as the corporate compliance training requirement that CMS has put out. And that's probably the biggest concern that we're seeing this year is making sure that everybody's taking care of that requirement.
So what is effectively changed about corporate compliance training for 2016?
Well, CMS has turned around and said that we want you to do our version of the CMS corporate compliance training. Effective January 1st, 2016, they're requiring all sponsors to complete corporate compliance and fraud, waste, and abuse training for all their employees of their organization. And that needs to be not modified to ensure the integrity and completeness of the training. And that's one of the biggest things that has changed. Now, this is for Part C and Part D. We want to emphasize that, participants. If you're in Part A and Part B, you can still complete a standard corporate compliance and fraud, waste, and abuse training. You're not required to take the version that is CMS's version that is not been modified. That being said, you can add to CMS's training. You just can't change their slide content. So what we've done is we've made sure we have both versions available, one for Part A and Part B participants, and then we also have the Part C and Part D participants corporate compliance training. And we've had great response for it so far, and we hope to continue to help people be compliant this year with that requirement.
Okay. Well, as we move into there is additional oversight in 2016, correct?
Tell me again, I'm sorry, it cut out on me.
I'm sorry. So as we move into 2016, there is additional oversight from OIG, correct?
Correct. OIG is going to be monitoring a lot, and I think Michelle is going to take us from there on OIG.
Okay.
Yep. So you're right, Eric. There is going to be quite a bit of additional oversight from the Office of Inspector General. And if 2015 was any indication of how the increased focus on exclusions will go, our covered entities, our clients should, and everyone on the call should ensure that you are checking the OIG exclusion list on a monthly basis. Of course, if you have reached out to HCP to ask about this service, you'll know that we do provide this service for you. And if you're not currently using our service, we'd be happy to help you with that. But just so you know, it is a requirement that you schedule a check on a monthly basis. So let me give you a little bit of background. In 2015, there were numerous enforcement actions due to organizations who employed an individual that they either knew or should have known was excluded from participation in federal health programs. And because of that, the OIG work plan for 2016 has increased the focus on checking not only covered entities and business associates, but they're actually focusing on states and CMS to see if they're checking the exclusion databases before enrolling providers. So if the OIG is checking the CMS and states, they'll definitely be focusing on covered entities as well. So
okay.
So that's our comment here is be aware that there is an increased and continued focus. And if the task force finds that you've employed or contracted with excluded individuals or entities being business associates or vendors, you could actually face fines and penalties. So that's a concern.
That's a specific requirement from CMS, regardless of your participation A, B, C, or D within the Medicare or even the Medicaid programs, correct?
Yes. Any individual that you have hired, you need to make sure that you are screening all of your employees, all of your vendors and subcontractors against the OIG's list of excluded individuals and entities, or LEIE for short. And you need to both run them against this prior to hiring or contracting and then monthly thereafter. And we also suggest that your organization should perform internal audits and walkthroughs to ensure compliance policies and procedures are in place, as Chad was speaking about previously. You want to make sure that you've documented that your employees are properly trained. That's another way that you can protect yourself from these audits and fines. And then finally, as Chad also touched on, that security risk analysis must be performed. It needs to be performed, reviewed. There's just no exceptions. It's needed for HIPAA, general compliance, and meaningful use.
Okay. So we did have a question that's just saying that we're recommending monthly checking of the exclusion list. That's not us making that recommendation. That is CMS's recommendation, correct, Michelle?
That's right, because the Office of Inspector General will update that list on a monthly basis, and they suggest that we, as covered entities, check against it regularly, and by regularly they mean when it's updated. Because it's updated monthly, then you need to do those checks on a monthly basis. And again, that's for your employees, your business associates, and your vendors.
Yeah, and that's the business associates and vendors is probably some of the weak points within the system. You know, your employees are not moving around tremendously. You've had them working with you for a significant amount of time, but your vendors are doing things with other covered entities that you may or may not even know about. So that can be a very big
Right.
exposure area for you as well.
I would agree, because if they are dealing with other people, you don't know what sort of business dealings they're having. For months to months, you may not know that they've been added to the list. So very important.
We did have a question. I'll move it to the Q&A section on the end, but
Okay.
just for your knowledge, Michelle, we did have a question about, are you an A, B, C, or D participant within the Medicare program, and what defines you as an A, B, or D participant within the program?
Okay.
Generally, but there are specific call-outs for how you're participating within the program. Okay?
Okay, so we'll review those at the end.
Yeah. Okay.
So let's, should we go on to the next bullet point then?
Yeah.
Let's see, where
The
do
new
we
compliance risk areas, is that what we want to move on to?
Yeah.
Or do we want to move on to the next screen?
No, I think we're good. We want to talk about those new compliance risk areas. So
Okay.
we know that there are 22 or 21 new compliance risk areas for Parts C and D, and I just wanted to really quickly, I'm not going to go into what the focuses are, but just know that there are 4 new risk areas for hospitals, 2 for nursing homes, 5 for prescription drug activities, 4 for medical equipment and supplies activities, and 6 for other providers and suppliers. So that's such a broad list of entities. It's highly possible that your organization falls under one of those areas that's being considered for audits and reviews.
Yeah, and I think, it's interesting. You talk about prescription drug activities or medical equipment activities, providers and suppliers, depending on where they're at in the chain. So you could have various portions of those could apply to you in various ways. Again, those specific requirements will be part of the white paper. But getting down into the details on that would just take up basically an entire webinar in and of itself.
It really would.
Yeah.
Let's just take a moment and focus on that last bullet point on the OIG slide, the heightened focus on fraud, waste, and abuse under Medicaid. So again, this is a 2016 expansion in the OIG's interest in fraud, waste, and abuse, and they're continuing their previous initiatives that are focusing on prescription drugs, billing and payment. You're all very familiar with these things: quality and safety, community-based care, information systems, and Medicaid managed care. It's very similar to what you've seen in the past, but the thing that we're concerned with is that they are increasing their focus so that although some of these areas have been areas that they've looked at in the past, they'll still be continuing to focus on those, and then additionally those other areas that we discussed.
If that being the case, we're going to move on to MACRA, MIPS, and AMPS. Really fun discussions. And, obviously there was a lot of headlines over the last few weeks about the acting administrator making an announcement that MU was over, almost immediately coming back and saying, oh, well, I kind of misspoke. We're going to be reevaluating meaningful use. But for that, we're going to be having Chad Schiffman go over some of the requirements under the MACRA, MIPS, and AMPS programs.
Well, thanks, Eric. And exactly as Eric said, according to the statement by Mr. Andy Slavitt, he said, in 2016, meaningful use as it has existed with MACRA will now effectively be over and replaced with something better. Which, a lot of people are really ecstatic about that because, let's face it, meaningful use in all of its good intentions has had several issues for providers to, get things taken care of and be in compliance with, to report on. It was a nightmare. There were a lot of things, that just really impacted the provider negatively. So we're welcoming this change. However, it's going to be a change that's going to take some time and to see how MACRA is going to roll out.
Yeah, I think, but if you're looking at meaningful use being effectively over, what are they talking about moving it over to? And I think that's the evidence-based medicine, the outcome-based medicine, And that's going to be all of these bullet points that providers are going to be focusing on moving forward.
Yeah, and they, it's like you said, they had to come back and reel it in a little bit, and they did that in a blog, in a joint blog between Mr. Slavitt and Dr. Karen DeSalvo, and she's the acting administrator for HITECH. And they turned around and said, the approach to meaningful use in our macro won't happen overnight. Our goal is communicating our principles now to give everybody time to let them know what's next and to continue to give us input. They're encouraging everybody to look at macro regulations this year. But in the meantime, our existing regulations, meaning meaningful use stage 2, including meaningful use stage 3, are still in effect. And that's something really important we want everybody to understand is for the meantime, we need to continue on and be diligent with meaningful use stage 2 and meaningful use stage 3. Now, with MACRA, there's going to be a lot coming down the pipeline.
Okay. So what are the ways that MACRA are going to impact providers? I know that there's some kind of a difference of opinion of the timeline for these changes as well, right?
Yeah, there is. First of all, the MACRA, which actually stands for the Medicare Access and CHIP Reauthorization Act of 2015, includes 3 important changes to how Medicare pays those who are given Medicare beneficiaries. Congress advances through the passage of MACRA because, as you mentioned, they are focusing on quality, cost, clinical practice improvement activities, and calculating how physicians are paid or reimbursements are received rather than just meaningful use. What's interesting with this, though, is MACRA is what was responsible for repealing the sustainable growth rate mechanism, that really impacted the physician fee schedule, which we very much welcomed. And it's important to note that, MACRA will continue to require physicians to be measured on their meaningful use of certified EHR technology. That's something that will still be incorporated. It's just the reporting mechanisms. A lot of the objectives that you had to report on are going to be, that's what we're seeing is going to be effectively over. There's going to be new requirements, which leads us to merit-based incentive programs, or payment systems, and alternative payment models. Those are the two paths providers will be able to.
Are those the 2 quality programs to determine your MACRA adjustments, the merit-based payment system and the alternative payment models?
Yeah, that's correct. Beginning in 2017, eligible providers will be able to begin participating in either the MIPS program or merit-based incentive-based system or an alternative payment model. MIPS is actually intended to streamline the various reporting mechanisms for physicians. What it does is it combines the PQRS system, or the Physician Quality Reporting System, the value modifier, and the Medical Electronic Health Record Incentive Program. So it combines that and basically focuses on quality, resource usage, it focuses on clinical practice improvement, and then, like I said, the certified use of EHR. They want to make sure that you're still meaningfully using your EHR technology, and so they pumped a lot of money and time and effort into that. That part of it they're not going to get rid of. With alternative payment models, physicians are able to, it's once again adopting new models of care. So if you look at those, you're thinking accountable care organizations fall under that category, maybe patient medical homes. These are all examples of alternative payment models. Now, with this, just as even yesterday, there was another update that came out, but we are totally expecting clarification to continue coming in on MACRA, MIPS, and APMs fast and furious over the next couple of months, and we will definitely be keeping everybody updated on this. We are following them closely. This is going to be part of our Compliance Insider. It's going to be in that 2016 updates and hot topics module that is going to be available to everyone following this. Also, in our white paper, we're going to actually have a whole series on this. So we're watching these updates, and we just want everybody to know that MACRA is where we're going next, and we're here to help you.
Yeah. it's kind of an interesting concept. You know, they're scaring everybody with these new alternative payment models, whether it be MIPS or APMs, changing MACRA, but we're still in the comment period. We haven't even had a final ruling on any of this yet, have we, Chad?
No, and that's what we're actually watching really closely for in the next couple of months is the final rule will be coming out on this. It's only proposed stages now, but they have made it known that, you know, it's funny. CMS initially said, well, we're not ever getting rid of meaningful use. We're not getting rid of that. We're doing it. Then they come out and say, now we're moving to MACRA. And that is where we are going next. And so we're going to continually see clarification come out, such as yesterday's clarification with the new core model or core measures. Those are all things that we're going to just keep a close eye on for our clients.
Okay. I appreciate that, Chad. And again, Chad will be reporting in our Compliance Insider regularly on as the comment period expires, as the final model is adopted on that as well. So moving on to HR and Department of Labor changes, we'll be changing back to Michelle Lyman. She'll be working us through the HR program. Okay?
All right. Wow, we have covered a lot of really technical information. So let's dig into HR and see if we can understand what the changes are that the Department of Labor is throwing at us this year. So the first thing that we'll be discussing is the Affordable Care Act reporting and penalty updates. There are 5 new mandates that are going to be changing in 2016. They are quite technical, and they will focus on employer mandates and transitional relief changes. So these 5 areas will be coming online, and all of the information is going to be included in the white paper. I've got it all typed up and ready to go for you, so you have all of the details of what is going to be involved in those. And then I'd just like to go on to discussing the Fair Labor Standards Act. So this FLSA minimum wage is kind of an interesting an interesting area. Let's just talk about the white-collar overtime exemption rules. And I don't know if you've heard about this, but it again is very technical, and we'll cover it a lot in our white paper. But basically, what's happening is the minimum salary threshold is going to rise. So let's say a worker is now at $23,660. That's their annual salary. That's the threshold a worker must hit to be overtime exempt. So if they're making that much money, then they are exempt from being qualifying for overtime pay. The proposed rules seek an increase to $50,440. And we're told that while it might not climb quite that high, it will climb likely to around $40,000. So go ahead, Eric.
And this there hasn't been a change to the overtime exemption standard for a significant amount of time, so that's why they're looking for the change update now. Is that correct?
That's right. And in fact, for the first time ever, the salary threshold is going to be tied to an automatic escalator. So that means it will automatically update so that the government doesn't have to go in and request additional legislation. It will automatically update as time goes by. And these changes, again, are in the news, and we haven't seen any final legislation yet. We know that the final legislation is expected after July of 2016, but this is definitely something that we'll be sharing with you in a variety of different platforms, including the Insider newsletter. So do make sure that you're watching those newsletters, because that's where we share this type of information with you.
Okay. I hear there's going to be a number of minimum wage changes, or have been, for 2016. In fact, a number of our listeners are probably in states that may have been affected. But what are we looking at for minimum wage changes in 2016?
So there's been some interesting things that have changed. The government has actually changed a federal minimum wage, but that's only for federal subcontractors. So if a person is working as a federal subcontractor, their minimum wage has increased to $10.15, but that's the only federal increase. The White House does support and has proposed a national increase to $10.10 for the average worker, but this hasn't been implemented, so we won't worry about that until we see further legislature. But there have been many states, in fact over 20 states, and many cities within those states that have made changes to their minimum wage. So I would encourage those on the call who have interest in seeing, which states and which cities within those states have made those changes to minimum wages, go ahead and check out that information in our white paper and also our updates module. And then the last bullet point on that page is additional guidelines. And I just wanted to let you know that although HR is not our total focus with Healthcare Compliance Pros, we do provide several helpful resources for you. So I would suggest that you go to the forms section. Right now, you can look at the Department of Labor overtime calculator, the pay calculator worksheet, the overtime exemption worksheet. All of those worksheets from the Department of Labor are in your forms section on the HCP website. And as these changes are put into place, as the legislature is finished and we do know what the minimum wages are and what the level of the white collar exemption is going to be, those worksheets will be updated.
Well, thank you, Rochelle. We did have a couple of questions come in during our presentation, specifically on the Medicare A, B, C, and D. A and B generally are what is called traditional Medicare, both hospital and facility coverage under A, and then the services provided under Medicare B. Those are traditional. Medicare C generally applies as Medicare Advantage, and then a D program would be the addition of prescription drug coverage to any of those as A, B, C, and D. So hopefully that does answer that question. Additionally, the white paper is available. You do need to email support for them to provide that information to you. The white paper is available again by emailing support@healthcarecompliancepros.com. Again, there is a module that has been created that has all of the updates. You can do specific training for your employees. You can assign it out to the employees for attending this webinar. You just need to contact your compliance advisor or email support@healthcarecompliancepros.com. And if you would like a copy of the white paper, you can request that again at support@healthcarecompliancepros.com. I want to thank everybody for attending, and if there's no other questions, we're going to close the meeting down. Thank you.